Sustainable Development Goal Arash Kanami, Aspen University, July 26, 2021. Subjective. The following is a presentation of the third Sustainable Development Goal, which is good health and well-being. The presentation will discuss in details good health and well-being, its purpose and the policies that will impact it. In addition to that, the presentation will analyze why this goal needs to be implemented and fully funded. Introduction. In 2015, the United Nations, under the 2030 Agenda for Sustainable Development, came up with a blueprint for peace and prosperity for people and the planet, now and into the future. At the heart of this blueprint are 17 goals that will change the life of millions of people in the world, today and the future. All the 17 goals will improve the global life, but one of the goals that will significantly improve global health is goal number 3. The 17 goals include 1. No poverty. 2. Zero hunger. 3. Good health and well-being. 4. Quality education. 5. Gender equality. 6. Clean water and sanitation. 7. Affordable and clean energy. 8. Decent work and economic growth. 9. Industry, innovation and infrastructure. 10. Reduce inequalities. 11. Sustainable cities and communities. 12. Responsible consumption and production. 13. Climate action. 14. Life below water. 15. Life and land. 16. Peace, justice and a strong institution. 17. Partnership for the goals. Goal number 3, good health and well-being. The goal that aligns with my interest, that one that I'm passionate about, and the goal that is going to significantly improve global health is goal number 3. Goal number 3 is titled Good Health and Well-being. This goal seeks to ensure that there is a healthy living, and also it will seek to promote well-being for all people at any age. The goal is to fight every disease possible by the year 2030. In this goal, there is a bold commitment to end the epidemic and communicable disease by the year 2030. Everyone is at risk for contracting the epidemic and other communicable disease. However, there are some set of population that are vulnerable than others. They include children, women, people with disabilities, especially those living in development countries of the world. Health policies. There are different healthcare policies that are implemented in the country and other parts of the world that will impact good health and well-being. The Department of Health and Human Services has been monitoring healthcare services for all American citizens. Different nations have different health policies, but some of them revolve around the same issues, such as achieving universal health care and medical insurance. The policy that will have a huge impact on SDG number 3 are Medicare, Medicaid, Affordable Care Act of 2010, Children's Health Insurance Program, Universal Health Care. Medicare is a health coverage for people who are 65 years older or under 65 and have disability. Medicaid provides health coverage if you have a very low income. These policies will affect healthcare and well-being to positively contributing to people who can affordable healthcare. On March 23, 2010, President Obama signed into law that Care Act of 2010. The act was a huge milestone toward achieving good health and well-being. The law addressed the issue of rising cost of healthcare in the country. The law impacts SGD3 by ensuring that low-income earners in the country access quality and affordable healthcare services. Children Health Insurance Program, or CHIP. CHIP provides low-cost health coverage to children in families that earn too much money for quality for Medicaid, but not enough to buy private insurance. In some states, CHIP provides medical coverage for pregnant women. This program has impacted SDG3 by ensuring that children and unborn children have access to medical insurance. With more children accessing healthcare services, the country is moving on the right path toward Vision 2030. Universal Health Coverage, or UHC. This is one of the most policies in terms of impact created toward achieving SDG 3. The policy seeks to ensure that all people can access healthcare services at any time without financial constraint. In a world where most people are poor, these policies seek to ensure that there is a healthy population just like SGD 3. Why Goal 3? The reason why I selected this goal is because it has a direct impact on global healthcare. The goal aspires that by 2030, everyone will be living a healthy life. Epidemics and communicable disease will be a thing of past. The goal has already increased healthcare coverage in the world, and it has promoted healthy living to prevent the rise of diseases. Even though the goal has been blunted by COVID-19, it is on course to achieve all the set goals within the decade. SDG 3 has already achieved a bigger percentage of its goal despite the COVID-19 pandemic, which slowed down its progress. SDG 3 has managed to improve healthcare of millions of people in the world by reducing the infection rate of killer disease, especially among children. It has increased life expectancy and reduced maternal mortality rate. According to Saveliva and Banach 2019, SDG 3 has a proven record of what it has achieved and what it can achieve. There should be more funding for this goal so that it can handle different persistent and emerging health issues. Once the goal is well founded, it will increase access to affordable and quality healthcare in the world. It will achieve this by increasing the number of people vaccinated, improved hygiene and sanitation, and effective healthcare system. The United Nations, with collaboration and different state and the private sectors, have developed different sustainable development goals that seek to achieve peace and prosperity for people and the planet now and into the future. The SDG that will significantly improve global health is SGD 3, which is good health and well-being. The goal has already improved healthcare in the world significantly, and with more funding, it will recover from the COVID-19 and progress toward universal healthcare.